And then lastly, how do you convert a room to negative pressure?
I'm going to make it super simple. It's actually the little tiny unit. That's why we like hotel rooms. Almost every hotel room has a little tiny unit back in the corner. And actually, it is a self-contained for that particular room. You actually want to bring the pressure down 2 or 3 psi, and you actually adjust that unit to be able to suck more air out down through the bathroom vent to be able to have a negative pressure. On the door, you put a great big piece of plastic with a zipper on it. So you zip in, you go into the room. We can go into more details, but I don't want to bore you. But it's a relatively simple process. And if we can't use the existing unit, we're going to rip it out and put another one back in that's a higher pressure. We're trying to suck the air down so we have a negative pressure.
The Army Corps of Engineers deploys in a national crisis, tailoring what they do to the crisis at hand. 9/11 required a different response from, say, a hurricane. And in this moment, what this national crisis requires is A, speed, and B, building. And that is something that the Army Corps of Engineers can provide in both counts. What they are building now is hospitals, lots of them in different parts of the country, in federal partnerships and state partnerships where they're most in demand. Lieutenant General Todd Semonite is the Chief of Engineers. He's the commanding general of the U.S. Army Corps of Engineers. In normal times, we civilians do not hear from him directly all that much. But just watch him here. Watch the lectern in this next clip. Notice how General Semonite starts speaking, starts getting down to business, even before he puts his papers down.
Can we get a quick update on New York?
Sure. So, Barbara, before I talk about a specific state, I think it's important to kind of lay out our concept here because you've not heard this, and we're going to talk about this a lot probably in the next couple of weeks. This is an unbelievably complicated problem, and there's no way we're going to be able to do this with a complicated solution. We need something super simple. We want to use New York as this standard setter, and when I met with Governor Cuomo, he said right up front, what can I do? And I said, the biggest thing you need to do is start identifying facilities. And he said, how fast do you need them? I said, I need 1 tonight. I need 3 by tomorrow night. But the bottom line is we've got to do something very, very quick. Most of the governors are saying that their peak is somewhere around the middle of April. So this is not take all the time in the world to do it. This is what is just barely the most important things we have to do and to be able to come up with a good enough solution.
When a reporter asked about states beyond New York that have asked General Semonite and the U.S. Army Corps of Engineers for help, he responded by saying, quote, it's too long a list right now. In other words, I don't have time to reel that off to you. Joining us now for the interview tonight is Lieutenant General Todd Semonite, Chief of Engineers and Commanding General of the U.S. Army Corps of Engineers. General, it's an honor to have you with us tonight. Thank you for making time. I know you're incredibly busy, sir.
Hey, Rachel, thanks. First of all, thanks for having us on. And also, for all of us in the Department of Defense, I mean, our thoughts and prayers go out to all of those families that are affected by this terrible virus. And we in the Corps of Engineers, whatever we can do to be able to help mitigate this bed shortage, we certainly want to be able to do that.
Well, tell our audience in general terms what the Army Corps of Engineers does and what you've been asked to do so far as part of this pandemic response.
So we primarily do all the construction for the Army, and we do a lot of other construction for the Navy, the Air Force, and other key elements in the Department of Defense. But we've also been asked to step up for the interagency and to be able to help out. And specifically tonight, I'm really here talking on what we do on behalf of FEMA and HHS. So is almost a national engineering capability to be able to step up and provide options. And this is where you heard in that clip where a lot of governors said we've got to be able to build hospitals in a couple weeks. You can't build a hospital in a couple of weeks. And the whole goal of what we're trying to do is to go into an existing facility, something that's already built, and therefore modify it to be able to take care of that shortage. Just think if you've got a hotel or a sports arena. It's already built a code. It's already got water. It's got electricity. It's got fire safety. And then to be able to go into that facility and modify it just enough. We can talk about the Javits Center, but that's exactly what this great team is doing right across the street here tonight by converting a convention center into a potential hospital that can hold up to 2,900 people.
About how many different facility conversions of the type that you're describing is the Army Corps of Engineers right now involved in around the country?
So I'm going to break it down. There's really 4 different standard designs, and that's the real beauty of what we're trying to offer to states here. We don't have time to site adapt every single one and redesign every single facility. So we're really going into a college dorm or a hotel or we're going into a large sports arena or a convention center. Those two type facilities are either going to be COVID or non-COVID. It's up to the state and the local mayors to decide what they want. It's very, very hard to take an arena capability like the Javits Center and to be able to make it COVID compliant. You heard on the clip a little bit earlier, it's it's relatively easy to go into a confined room like a college dorm or a hotel and then be able to modify that just enough to be able to put in a patient in there to be able to put a COVID patient in. You asked about how many. Tonight we've got 103 different assessments we're doing in 50 different states in 8 different territories. I think we've got about 78 done right now. And the main thing is writing contracts tonight, tomorrow, to be able to make sure that contractors can get boots on the ground to be able to make something happen. And it goes back to this whole point. This is not where I ask our guys, how long do you need to do it? This is where you got to tell them, you got 2.5 weeks, you got 3 weeks. Every single governor knows exactly when his peak is. And if we can't get these projects completed, then we've missed this very, very valuable window to be able to step up and to be able to take care of that shortage.
If you had and I know every situation is a little bit different, but you're talking about standardized facilities. If you had, say, a college dorm type facility and you were going to try to turn those into COVID beds in a college dorm, what kind of time frame, what range of time would you need, would the Army Corps need in terms of these contracts you're doing to get that actually up and running from the first day that you were called until they actually were admitting patients?
Well, that's the great thing about going in an existing facility that is already operational. And so they're all the code. You just got to do a couple conversions. I talked on the clip about the pressure piece. You do need to put some other modifications back in. The other thing is, don't forget, these college dorms are relatively empty. These hotels are relatively empty. And you know, President Trump said a couple of days ago, he said, this is the time when we need the entire nation to rally to step up. And we're seeing this. We're seeing contractors calling to us and saying, what can we do to help? The hotel industry is calling us, say, I'm willing to give you some of our hotels. How can we work that? So working with FEMA, where we provided a kind of a standard lease, we'll go give it to the state and say, here's what you could do with a local hotel. We've got standard designs. But the unique thing is we have to site adapt these. And then in the Corps, we delegate this down to the lowest level. So our colonels, our senior civilians can then site adapt it and put it in the ground. And then even to the point, you don't need the Corps of Engineers. We can give our designs to any state in the United States. They could go to their contractors. They got to get they got to do paperwork with FEMA on it. But the bottom line is we don't have time to do all this with a very, very strict governance. We've got to be able to trust our engineers and to be very, very aggressive in trying to find ways that you could take facilities that are pretty close and then modify them accordingly.
Let me just ask you one very practical question, and this is a weird thing to sort of litigate on national TV, but I know from the feedback we get from our audience every night that some of the people I'm about to describe are watching here. If there are local officials, if there are big city governors, or if there are county executives, or even state officials right now who are concerned about what's going on in their state, who are seeing the numbers rise, who believe that a local, disused convent or a local college dorm or a local hotel that might be able to be purchased publicly needs to be the kind of facility that you're describing, what's the chain of command that they need to activate in order to get the Army Corps of Engineers on site locally doing that work soon?
Vice President Pence has said this very, very clear. We're going to use normal FEMA processes, so they've got to nominate those facilities back into their states. Our engineers are embedded in each of the states' emergency management capabilities, and then the governor gives us a list. We've got to figure out those sites. That's a governor's call to figure those sites out. And once those calls come back in, then we'll be able to do it. We're in right now, Seattle Seahawks Stadium is the next big one we're looking to design, to be able to put hospitals back in there around the underneath part of that stadium. So call your state, get it on the list, then our engineers will pull that off. We will advise the state of can it be COVID, can it be non-COVID, and then that will go up through FEMA, hopefully get approved, and then come back down to us, and either the state can build it or we can build it.
Lieutenant General Todd Semonite, Chief of Engineers, Commanding General of the U.S. Army Corps of Engineers. Sir, thank you for speaking about this with such clarity. Thank you for speaking and moving quickly. It inspires confidence, sir. Good luck with your work.
Well, you got to come out and see what all the team's doing. And that's the big thing. This is not the Army Corps of Engineers. This is FEMA. This is HHS. This is state. I was with the mayor of New York City an hour and a half ago. This is leadership getting involved by trying to figure out, don't wait to ask. Don't try to wait till the phone rings. Get ahead of it and then predict what's going to go wrong and have the good enough solution on time.
General Semonite, head of the Army Corps of Engineers. Sir, thank you very much. Godspeed to you.